Hello, everybody, and welcome to our webinar where we're going to talk about Decent and their use of direct primary care as part of an integrated employee benefit. We're going to give everybody a few more minutes to log in, so we encourage you all to sit tight, to refill your coffee or your water or whatever drink you're drinking today. And in 2 or 3 minutes, we'll check and see that everybody is signed in, and we'll get started. But please stand by. We'll be ready to go in just a minute. For those of you just joining, we're going to give it another minute or two. We see a lot of people logging in. We want to give everybody a chance to get online. So, stand by for a minute, refill your water, your coffee, and we're going to get started in just a minute with our live content. Hello, everyone. Thanks for joining. Please stand by. We're waiting for people to log in. I just got a message from Haley. We've got enough folks online that we can kick off. So I'm going to go ahead and get us started. Hello and welcome to today's webinar. A friendly reminder for everybody that this webinar is being recorded. So if you have to leave early for any reason, we hope you don't. But if you do, please do come back and see the rest of the stream at your convenience. I'm Dave from Hint. I'll be moderating today's discussion. Today, I'm joined by Dr. Ben Aiken from Decent Health and Colton Stoller from North Risk Partners. Our topic and goal today is to share some success stories and maybe some more stories too about how Decent is transforming healthcare, specifically by incorporating direct primary care into an employer-sponsored health benefit. Our agenda: we plan to spend the first 30 minutes of today's discussion learning how Decent is innovating around direct primary care. We're going to learn more about how North Risk Partners is working directly with employers and employees to design, sell, and implement these innovative benefits successfully. Then we'll talk about some of the challenges and obstacles that both Decent and North Risk have faced in the market and how they're overcoming those. And then around the 30-minute mark, we're going to open up the floor for your questions. So please use the chat function to submit questions in real time. We'll do our best to spot the themes of highest interest and make sure that we spend the right amount of time on them. Thanks again for joining us. And Ben, I'll ask you to introduce yourself first.
Sure. Hi, everybody. My name is Ben. I'm a family physician and have been in a DPC practice called Lantern Health in Western North Carolina, specifically Asheville, for the last 6 years. We have 2 locations and now a team of 8 docs serving clients, including employers in this space. Through that work with employers, I got connected to the work being done at Decent now several years ago, and currently I'm serving in the head of direct primary care role for the Decent team as well, and really excited to be here.
Thank you, Ben. Glad you're here. Colton, take a minute to introduce yourself, please.
Yeah, Colton Storla, Vice President of Employee Benefits at North Risk Partners. Been in the business for a little over 7 years now, just working with employers with all sorts of employees, 1 employees up to 1,000 employees. So all business types, all industries, just trying to, manage that health insurance spend as being kind of where my passion lies, and usually where, the CEOs, CFOs, and HRs, where their kind of biggest motivation to get under control as well.
Cool. Thank you for taking us through that. So, Ben, if you don't mind, I'll start with you. Give us a little bit of background on how Decent defines direct primary care, and why did you choose to invest so heavily in making that part of your innovative benefit program?
Yeah, sure. I think the thing that attracted me to Decent, however many years back now, and still attracts me to it today, is really it leads with direct primary care. It thinks of direct primary care as the foundational element of the health plans that it's building to serve employers. And in my experience over the past 6 years, and now serving over 60 different businesses in the direct primary care model, I've yet to come across someone who is as emphatic about where direct primary care sits. And so to have plans built around direct primary care to take advantage of the great things direct primary care does, but then also to work in concert where there are certain pain points that I, as a direct primary care physician, may come in contact with, have aspects of the plan built to basically help, me overcome some of those pain points and actually deliver higher value care to a patient, I think is really exciting.
Yeah, I appreciate that. And Colton, I'll ask you a similar question. When did your group start incorporating direct primary care into employee benefits, and how's that adoption curve been progressing for you?
Yeah, we've been building plans with DPC or direct primary care for about 2 or 3 years now. I'm actually in my direct primary care doctor's office as we speak. He was kind of the first one that went down this path of working with an employer with me. So super exciting stuff. But how I try and talk to employers about direct primary care. I try and simplify things as much as possible and say, you got 4 buckets where claims are being allocated. That's going to be pharmacy, inpatient services, outpatient, and primary care. And I believe from, foundational standpoint, with good primary care, that's going to mean, less hospital stays. That's going to be less orthopedics. That's going to be less prescriptions that employees are on, even though there's, certain cost containment, levers that we can pull in those 4 areas. But let's just get, the employees healthy, and the current model of, fee for service and some of these big hospital systems that are buying up all these, independent primary care physicians practices to use them as a funnel and not as primary care. Just trying to partner with direct primary care doctors as much as possible because they have the same alignment that a lot of my employers that I'm working with, and also my philosophy as I'm meeting with employers.
Yeah. And Colton, if I can follow up on that, when you're talking with employers and employees about direct primary care, 2 things. What is it that most excites them? What is it that also most concerns them?
I would say, the things that excite them, as we start to talk about direct primary care and, the individual that's sitting in front of me that starts to get it, they'll smile and say, this is what healthcare used to be. And I'm like, yes, exactly. Okay. I explained myself perfectly.
Yeah.
I would say the biggest pushback that I get from, employers or the C-suite or HR, whoever, there's no way my employees are going to, break up with their doctor and go see a completely different doctor. And as I'm getting into employee meetings, I'm, educating employees saying, hey, this is now a benefit. If we get over that hump of saying, hey, we're going to move forward with this. A lot of the employees are saying, oh, I haven't been to my primary care doctor in 10 years, or I don't even have a primary care physician. Or of course, there's those employees that just simply don't go because of, the unknowns of the financial burdens that they might, take on by going to the doctor because they've been burned before.
So it creates a lot of predictability. Is the opportunity to have a relationship with a primary care physician a big driver, it sounds like.
Yep, exactly.
And Ben, anything you would add to that? How do you all see it when you're out there talking to both employers and employees? What excites people and what concerns them?
Yeah, I think Colton really hit the nail on the head that, in essence, folks that have experienced maybe primary care of yesteryear kind of say, wow, this actually really feels like something I used to have and I no longer have. But there's also an emerging kind of population of younger folks who really have never experienced primary care in the way that we feel like it should be delivered. And so sometimes that can be a harder hurdle to overcome in terms of convincing them why this matters. In our experience, we're really very much focused on getting people in the door for that first appointment. In our experience, kind of whether you're 20 or whether you're 60 or somewhere in between, if you get in and you actually see what it's like to have a DPC doctor with 45 to 60 minutes of time at that initial appointment, whose model is built around getting to know you and have a relationship with all of, tech enablement and virtual access and all the different things built in, it can be a little bit of a light bulb moment for folks and saying, oh, wow, I've got this. And, I have, in essence, unlimited access to this, both virtually and in person. That really hits and strikes a chord with folks. So we do emphasize trying to get people in in that first appointment. The other thing I'll mention is really our goal, I would say, is to be somewhere north of 90% adoption of direct primary care for people that are coming on our plans. And so you will see in different employer plans where, if you hit 50-50, people are high-fiving because this is the new thing, or, to Colton's point, you have a pre-existing relationship with a PCP. Though we are seeing that kind of pre-existing relationship with a PCP start to be less and less in terms of conversations we're having with folks. We do create a pathway. I mean, really, part of what we love in DPC is this long-standing relationship. And if you have a long-standing relationship with a previous provider, there is a path for you to remain engaged with that previous provider. We do want to meet folks where they are there. But all of the incentives of the plan are built around leveraging the DPC, and that facilitates decreased cost downstream for anything that's referred outside of the DPC office, in essence, at zero copay for members. So we've certainly thought about this, problem quite a bit, and feel like that we've built the plan and also the onboarding experience to really emphasize higher adoption of DPC on the front end.
Yeah, those are great points. Ben, one follow-on question for you. How does Decent work with brokers, and how important are they to your success and to the success of your employer customers?
Yeah, it's a really good question. They are key partners for us. So we look at the broker community as our key partners in terms of getting out into market and gaining the trust of employers that we're trying to serve. Our experience has really been that nationally, brokers are the ones that have the trust in the ear of the employer, and help guide them in towards making a decision. So we've really focused on having a synergistic relationship where it's a win-win for both the broker and for us to have an employer engage with our plans. So we certainly continue to learn a lot from brokers, and are finding more and more brokers are really looking for an alternative option to the status quo, because they're increasingly tired of saying, hey, listen, I have no control over this, but your percentage increase is 12% or 15% or 20%. And that can be a hard kind of road to hoe. And certainly Colton can speak to this better than I can. But in essence, we really are trying to present a really viable win-win option for the brokers that are out there with this plan.
Yeah. And Colton, let me ask you the same question, but in the opposite way. How is based on, I'm sure you've worked with a lot of carriers and a lot of insurers over the years, but when you guys work with Decent, tell us how the approach has been different, how the experience has been different, both from your perspective and from the employer perspective.
Yeah, I think Ben said it well. It's a win-win situation because, my motivation is to try and, decrease the, health insurance expenses to a business, and, try and make that, not as volatile and, sustainable over time. And what I've found is, as I've partnered with direct primary care doctors, they've, had the motivation to want to work with employers to get, larger volumes versus, just having those individuals off the streets that maybe, might be a Medicare beneficiary or just an individual. Or they've tried speaking with employers and about their services and how great it is, but some employers have had a long history of taking on single and double digit increases, and then you're trying to talk to them about adding an additional cost. But if you have a plan like Decent that, you're, looking at the, independent TPAs, you're looking at a fiduciary PBM that's transparent, and then you layer in the DPC. I mean, I've been in situations where I've lowered, going up against a BUCA plan, their health insurance premiums by 25%, put money back into that business, and then added the benefit of direct primary care all in one full swoop. So certainly a winning situation for both the employer and the employees, because now they've got, accessible and affordable health care for a fraction of the cost.
Yeah, those are the kind of stories we love to hear. I'm sure we've all been in situations where we've got a skeptical CFO on the other side of the table, or an actuary who says, wow, it looks like you're asking me to spend a lot more money on primary care. How do you overcome that obstacle? And how have you been successful in convincing and proving that direct primary care doesn't just improve quality of care and experience, but also helps lower healthcare costs?
Yeah, I mean, is that a question for me too?
I would start with you, Colton, but I'm hope Ben can add on to it.
Well, I think when the C-suite's looking at their health insurance costs again, everybody's getting their costs are going up, and they're faced with different decisions when their costs are going up. Do I pass those costs off to the employees? Do I take that on as a business and let that eat into the profits of my organization? Do I raise deductibles, or do I do a combination of all three? God forbid, but I've seen it happen. And I've even been in situations where some employers are already on that 6, 7, 8. I've even seen a 9,100 high deductible health plan. And so at that point, the employees are probably just scared to utilize any sort of service, whether it's picking up their prescription or going to see primary care. So being able to add a benefit like direct primary care, again, to make it accessible and affordable so you can get the care that your employees need. So that they're, don't have those financial burdens, and they're happier, they're healthier, they're in the workplace, they're better employees, they're better, wives, fathers, husbands, whoever. And you can't put a price on, good, your health and, good primary care.
Yeah, I thought that was really well said. Ben, anything you would add to that based on your experience?
Yeah, I think that sharing some examples of employers that have had success in the past is one strategy that we've utilized. We speak to the Milliman data that came out in 2021 about the power of the model, and then have really spent ample time almost educating exactly what DPC is with the prospective stop loss partners. Really, it's for I think a lot of us in the HINT community, DPC is a known thing, but for many people outside of our circles, DPC is still a relatively unknown thing. And so taking the time to really educate under the surface of how DPC changes the incentive alignment around utilization really potentially empowers downstream decrease in downstream spend, because so much can happen within the walls of the DPC. And then also really in partnership with a forward-thinking plan, has the ability to really direct care to the highest value partners. So the places where people are getting the highest quality and the low cost. And those things, it takes some time to really explain those things, but we're really starting to see traction in that community in terms of their willingness to say, okay, yes, like there is an increased spend, to your point, David, on the DPC primary care piece up front. But what that leads to from a downstream perspective really then allows us to drive down the price point of what we're offering.
Yeah, I think that's a great point. Couple more things I want to get to before we open it up to audience questions. And I'll direct this one, Ben, first to you. Colton, feel free to chime in if you have something to add here. It seems like making the decision to start a direct primary care practice is a really difficult decision for many physicians. What can we do as an industry to make it easier for providers who want to start direct pay practices?
Yeah, it's a really good question. I would say that it's a hard question. There's been many of us in DPC that have been asking this question now for quite a few years. I think that I'll speak to a couple things that I think can be helpful. So one, I think it's a relatively open source community. So if there are physicians who are out there who are looking to go and do this on their own, there are resources that you can access to go out and do this on your own. And there are a lot of people that are willing to help. So those pathways are pretty well trodden. And I think we're seeing increasing numbers of folks making the leap. As of 2 weeks ago, the latest statistic I heard from the American Academy of Family Physicians is that now 9% of their constituents are in the direct primary care model. So almost 1 in 10 family physicians nationally are almost into direct primary care. And so we're just starting to head up the hockey stick, if you will. That growth has really started to accelerate. So one path is individuals who are dissatisfied with their current offering and decide to come in themselves. As direct primary care matures, I also think we're seeing more practices that are looking to bring on additional physicians. And this really provides an increasing number of opportunities for physicians who don't want to necessarily run their own business to join up with a practice that is looking to grow and to expand. I think our practice in Western North Carolina is an example now with seven other physicians have joined me with that path. And I think there'll be more opportunities similar for us here, but also nationally. And then I think the final piece that I'll speak to is, as awareness in the employer industry, especially, but kind of in the payer world, starts to come around to the benefit that direct primary care can bring, theoretically, there's going to be more and more demand. And so, especially for somewhat risk-averse type A personalities, which is the physician community, there can be this concern about, well, hey, what happens if nobody shows up? And I think if the demand continues to be higher and higher, it really provides a kind of a less threatening financial shift into the model. And certainly that would be my hope. And Decent, we very much hope to be a part of really driving this increase in demand so that we can provide better pathways for more and more physicians to join the movement.
Yeah. And Colton, let me ask you a similar question about the employer perspective. While DPC adoption by employers is growing relatively quickly, it's still fairly small in the scheme of the U.S. healthcare system. What are some of the unlocks that need to happen there that will really open it up and make it so much easier for employers to start adopting things like direct primary care into their employee health benefits?
Well, I think employers, just thinking back to some of the meetings that I've had over the last, 6-7 months, probably dealing with, larger employers, they're looking at their health insurance spend and they're like, why are we paying this much? And almost starting to look at it like, what if we just hired on our own doctor? How much could we save? And so they're already kind of, without even knowing what direct primary care is, kind of thinking outside the box, some of them. But there are still several employers that don't even know that, direct primary care exists. And I'm in Iowa, so we're slow to adopt on everything. And so, just trying to, meet with more and more direct primary care doctors or, just physicians in general. We've got, a handful of hospital systems in, Cedar Rapids area or Des Moines. And I've got some pharmacist friends, I've got some doctor friends. And so sometimes I've had some of these conversations with them and they're like, wow, we've, have never learned about any of these things, in school or things like that. I just figured I'd graduate and go work for a large hospital system and that's it.
Yeah. Yeah. It's good to have alternatives and choices out there. A couple of sort of closing questions before we open it up. Both of your organizations have done very innovative work and the market is recognizing the value of your innovations. But I'm curious, to the extent you can share, what's next on the roadmap for you? What should we expect to see? What new innovations should we expect to see from your organizations in the future? And Ben, I'll direct that to you first.
Sure. I think in essence, we are now available nationally. And so what we're most excited about is seeing the traction we can get in the next 1 to 2 years now that we have a national footprint and capability for employers across the country to access what we're doing. So I think really this is a newer level funded product coming to the market for us after a couple previous iterations. And we've been at work at it for the better part of the last 1.5 years. And really at this phase is in market as of the beginning of July. And so what we're really excited about is frankly being in market and when I say being in market nationally and seeing where it goes.
Yeah, that makes a ton of sense. And Colton, how about you guys? What's coming down the pipe with you all?
I think, my, go-to-market strategy or just, consulting in general with, employers has evolved over the years just because, I've always known that self-funding in some manner is the future, whether that's, traditional self-funding or level funding or, captive type programs. But I've unbundled and, worked with independent TPAs and, different PBMs and networks and things like that, and tried to construct my own things. And there's some noise with that happens with employers and employees. But what I'm finding is the plans that I do have direct primary care included, they just run so much more smoother. Because I know the plan, we try and educate the employees as much as possible on the plan. But then if they're utilizing direct primary care, that practice that we're partnering with, a lot of times they know all the components of the health plan too, and they can steer or make suggestions in in different situations. Or if they don't know, then they can just simply, reach out. So it's more of that collaborative approach between, myself, the DPC, and the health plan, and just really trying to help these members as much as possible. Because we have a lot of just, jargon of deductibles and co-insurance and co-pays and networks and things like that. It's just super confusing. But I think if employees have, a single source of truth and go into their direct primary care doctor for almost everything, obviously, if there's an emergency situation, get to the emergency room. But, just leaning on those direct primary care doctors as much as possible to, steer, to high quality, low cost providers as much as possible. And then we've got, a health plan that's firing on all cylinders.
No, it's a great point. If we don't find a way to make this simple for patients, it's never going to work. And so creating that integration, creating that simplicity of experience in a complicated healthcare system is a really big job, and something that all three of us are going to be a part of. Sort of parting shots here. Are there any additional points that either of you guys would like to cover before we open up to audience questions? Ben, I'll offer that up to you first.
I think just thinking more about some things that we're excited about. We are looking very intently at offering an HSA plan that's compatible with DPC, which we think would be really exciting. So stay tuned. There could be more there before the year's up. But with that, I'm happy to take questions and give it over to Colton first.
Yeah. Colton, any parting shots for you?
No, I see we've got some good questions here. So I think that would probably cover it.
Got it. All right. Well, let's start that. And again, I would encourage you all to use the chat function to send us any questions that you have. And, we're, if there are 3 or 4 that are similar, we'll try to kind of group them together and make sure that we hit the high points. But let me start with one. And it's a question really about pharmacy costs. And the question is about, as a DPC practice, how can you control pharmacy costs from, within and without and outside of the DPC model?
Yeah, I'll take this one at least on first pass. There's 2 ways that I see it happen. So one is DPCs will actually dispense in-house. So they will wholesale purchase medications and then dispense those at wholesale pricing in-house and really bypass kind of any payer in doing that. And it provides an incredibly affordable option for the more common medicines that you would see utilized in primary care. So that's one, both from a convenience and a cost perspective that can be useful. As it relates to thinking more about the Decent side and the plan side, so Decent has been very intentional in selecting a fiduciarily responsible, transparent pharmacy benefit manager, in essence, that kind of takes out all of the extractors in the PBM process that you will typically see, so that the cost of medicines goes down, both for the member and for the plan. And then direction and kind of, if you will, steerage to making sure folks are really getting access to the high value medicines that are out there in ways that are affordable both to them and to the plan, so that it's really synergistic is the approach we take there. So especially when you think about the specialty medications that can be drastically expensive, that transparent PBM partner is a key to our ability to really keep those costs in check.
Good points, Colton. Anything you'd like to add to that?
No. On the pharmacy side, I think, Ben hit the nail on the head. I think all DPC practices that, in my experience that I've worked with, some have, 30 medications on hand that they're buying wholesale, and then some have, 350. So however, those want to be dispensed, whether it's at the DPC practice or through the retail channel at a pharmacy. But then, of course, trying to tackle those specialty medications, whether that's, internationally or MAP, PAP, things of that nature. And and having a good PBM partner is obviously super important. That is transparent and 100% pass through as far as rebates go.
Good answer on that. Next question is for Colton, and this is from an advisor. What do you find the difference between using the standard PPO network with Decent versus building a high performance network or direct contracting to the price? So, how much money do you find customers are saving between using a PPO network and a direct contracted network?
Yeah, with the high performance networks and direct contracting, usually the pricing is much better than what a PPO network is going to be able to provide, and that's why you're probably going to see larger decrements when it comes to the stop loss pricing. So you're going to get a better price for the high performance and direct contracting option. But then again, you have to consult with your employer and know, you don't want to bite off more than they can chew, because usually the number one question as I'm talking to employers about these options, the number one question is, am I going to be able to see my doctors? Am I going to get access to my hospital systems and things like that? So it's really trying to weigh your options or this employer's appetite on, how much do you want to control this expense and, member experience and things like that.
Mm-hmm. Let's see. I believe this one is a question more for Ben from Stacy Benson. When will Decent be available for employers?
Yeah. Hey, Stacy. It is available now. So if you are interested in getting a quote, you can reach out to me and I can connect you with the right folks on the Decent team. But the quoting process is live and it is available to employers around the country who are interested at this point. And one quick thought in terms of the last question, just thinking through things, is that I would just point out that I agree with Colton. Actually, Decent, we've now have 30 high performance network direct contracted partners nationally. That number is growing relatively rapidly as we try to build out options that are really high value for patients, employees, patients to go and to seek. So
there's no question. I mean, building networks are hard, but it's worth it. With just a little bit of focus and some talented people behind you, you can always beat the PPO discount. So I encourage people to pay attention to those direct contracted high performance networks. They absolutely work. All right. Next question is from Chris Imperial. And I think this one is for Ben. As a new DPC owner, how do you recommend that I start the process of finding employers? Do I need to have a broker who can write plans that include my practice, or can I just sell directly my own services to the employees?
Yeah, it's a great question. First off, congrats on being a new DPC owner. That's really awesome. I think landing those first employer relationships is really key, because once you've got a couple, they start to tell their friends, and then it can just snowball and grow from there. So it's worked both ways for us in our practice, where some small businesses that actually aren't offering comprehensive plans and just want DPC want to work directly with us, and that can work well. When it gets to larger employers, I would say having a broker on board who really understands where DPC fits in the broader picture of a plan has been key for us. And so we've taken a dual approach of some that are just directly with employer and some that are via broker. And our vision, as I spoke to a little bit earlier, as it relates to Decent and the plans we're bringing to employers nationally, is in partnership with the broker. So there's various options, and also happy to follow up directly kind of offline with you, Chris, if that's helpful.
And just to add on to that, 2 other resources that we've made available through Hint. First of all, we do have an employer handbook, which is written to help DPCs start with employers. We outline some of the basics there. So hopefully that's a helpful resource. And then the other thing to do is we encourage you to go to Hint community. And there you have access to all of the DPCs who are on the Hint platform. And you can actually just ask those questions, particularly if you're in a specific region or a specific market, about what approaches have worked and not worked in terms of marketing to employers.
Yeah, and I would say on that, I think it's super helpful. I think you're going to be, super helpful to find a broker that understands how some of these works, some of these, direct primary care and, health plans work, because it truly is what the title of this, live stream is integrating primary care into health plans. And if you have a health plan that does not complement the direct primary care, it's just probably going to be a lot more expensive and it's going to be a little bumpy. So being able to, sit at the same table with employers and the direct primary care doctor and the broker is very powerful, and having all those conversations at once. I would say that whenever I'm having those sort of meetings, it's, 9 times out of 10, we're probably able to get that, employer to, buy into what we're trying to do and, take the next steps. Because I've had some direct primary care doctors that have tried to get into the employer space without the broker sitting at the table. And sometimes that employer might say, well, you need to talk to my broker. And then if it's a broker that doesn't really know what DPC is, then they might poo-poo it right away or not understand it. So bury their head in the sand. And so I've had some actual direct primary care doctors reach out to me in different markets, whether it's, Indiana or Texas, that, just reach out and say, I'm struggling to get, employers over the hump. So I'm happy to always, meet with the direct primary care doctors or other employers to kind of talk about how we can build a plan that complements the direct primary care, where hopefully we're getting ourselves in a situation like that case study I shared earlier, where, we're saving you money while adding a benefit versus working with a BUCA style carrier where you're probably just adding an additional expense, but still providing a value to your employees. But, your most employers' number one goal is to probably save money at this point, but still, try and provide, a high level benefit for their employees as well.
Thank you for that. Ben and Colton, it appears that we've covered most of the audience topics that have come up. So I think we're about to wind it down. I'd like to remind everybody on the call that HINT's annual summit is fast approaching. It'll be September 27th and 28th in Denver, Colorado. We can't wait to see you all there. More importantly, I just want to say thank you to Ben and Colton for this great session. I encourage any or all of you to please feel free to reach out to any of us individually if you have follow-up questions. And we hope to see you next time.
Thanks, David. Really enjoyed being a part of it.
Yeah, thank you. Thanks, everybody, for joining us.
Thanks, y'all.